It was 1 week ago when the county health department announced the end of the COVID Compass system to track the virus. That system used a variety of metrics to assess the state of the virus spread and then assigned a category to the risk level, ranging from low to moderate to high to severe. The health department announced its replacement today. That relies more heavily on an individual's interpretation of the data as a basis for their behavior. News 19's Marcus Arsvold explains why health officials say this new process is more helpful. Marcus.
The new collaborative between the health department, Gunderson, and Mayo Clinic is set to better produce recommendations that people should follow based on more metrics than the Coulee Compass did. The new resource still uses colors you can base those decisions off of, but not just a one-shoe-fits-all. The Coulee Compass replacement is based on the Harvard Global Health Institute's guidance.
It is not a if this, then that type of formula. It is not a this color equals these responses. The data is what it is, but people interpret the data to make sure we have the right context and understanding, and then we make recommendations based upon that. And I think that is going to be a more informed and a better recommendation.
It focuses mainly on 3 metrics: new positive cases, number of hospitalizations, and how much space hospitals have.
Then in the recommendations and guidance tab, you will see what the analysis is, so to speak, of the data from the collaborative, along with the recommendations that align with that analysis.
Doctors say it gives more room for improvement by showing how flattened case counts are and indicates where we go from here.
Most importantly, the collaborative members will be meeting weekly and having the discussion and really allowing that full perspective so we can make adjustments as need be.
A week-by-week decision based on more metrics than the Compass.
It would be reassuring to know how things are going to be in September, October, and November. And if we had the ability to predict that, I think we would. But I think we need, nature of pandemics, we need to look at things to date and make recommendations based on that. And I think people in the community need to be informed and able to give us feedback.
Rombalski says they're still working on the new resources, but it should be ready by next Friday. Scott, cases are flat enough now where the health department won't send out its daily updates on Facebook.
Thanks, Marcus. The media briefings will now happen every Friday at noon, with additional briefings scheduled whenever necessary.